terrific session and one that has lessons for us all. I'm Ray Baxter. I am the co-chair of the Roundtable on Population Health. I'm also a trustee of the Blue Shield of California Foundation and a member of the board of directors of the CDC Foundation. So we have had an extraordinary 2 days here, and attempting to summarize all that's transpired is a Herculean task. I'd like to note the fact that this event marks a milestone on the Roundtable's trajectory since its founding and its fourth public workshop in 2013, 8 years ago, which explored the history of social movements for lessons to those who seek to build a movement for health and health equity. Several subsequent events considered the role and potential of communities, the value of multi-sector partnerships involving community organizations, the contributions of communities of faith, philanthropy, and many others. The topic of civic engagement, people coming together to work to identify and address a need or a gap, to find their agency and power in transforming unjust circumstances and conditions, has been a constant theme. And most recently, in our January 2021 workshop on community-led initiatives to improve health, which we also often call the Power Workshop, explored how power shapes the social factors that drive health, how narratives can be more persuasive than data, how cultivating and nurturing relationships and leaders from the community is essential. I believe that today's workshop pushed us further along in recognizing the path forward in transforming living and societal conditions that are responsible for profound health inequities in our communities. As we have heard over the past 2 days, civic engagement, not merely being a healthcare voter or advocating for sidewalks and transit equity, but working at the level of institutions and government to support and facilitate the infrastructure for democratic and inclusive civic engagement in every aspect of life and society, is a critical driver of health. Over the 2 days, I kept a running list of what I intended to be memorable phrases and often turned out to be provocative phrases, but the list is way too long to attempt to go through at this point. But let me just mention a few of them and then go to some of the overarching themes that I think we covered in these 2 days. The first was health inequity is not an accident. Another was you can draw a straight line from the communities that were undercounted in the census to those that were hit hardest by COVID. The political determinants of health are a set of conditions we need to pay much more attention to. Another statement was method effects are profound, challenging the methods that we have used, both quantitative and qualitative up until now, to mine data and information and tell stories. Another was representation and presence have a cost. Are we willing to pay people for civic engagement? Yet another, public schools were founded as, quote, crucibles of democracy. Are they? One more was the removal of democracy is never an acceptable solution to a problem, whether it is the closing of polling stations in sovereign nations in New Mexico or the imposition of an emergency manager in Flint, Michigan, who could switch to a toxic leaded water supply. And finally, national stories are driving a narrative of polarization and divisiveness. This can foster more polarization and withdrawal from civic engagement. So what were some of the themes of the last 2 days? One, the breadth of community engagement, from voting to youth councils to information campaigns. The vote is just one dimension, an important one, but just as important are setting the agenda and asking the question in the first place. and then shaping the implementation afterwards. The critical role of information. Where does it come from and who is the messenger? The power of modeling. The power of institutions when they model, not just teach or preach how things should be done. Fifth, what are our trusted vehicles for civic engagement? What happened to unions and faith institutions, neither of which were mentioned much in the last 2 days? What does that tell us? Does engagement itself improve health equity, or is it good policy that reverses entrenched racist and exploitive structures? Is that the goal? We learned how facts and data don't stand on their own, how they are used to fill in a narrative with a plot that can encourage or discourage civic engagement or withdrawal. Finally, the importance of deliberation, as we just experienced. Deliberation characterized by evidence, reasoned argument, honest personal testimony, empathy, and careful consideration. These are among the themes that we covered in the last 2 days. This has been an extraordinarily rich, provocative, and educational experience for all of us. Thanks to our distinguished moderators and panelists, and to the planning committee and staff. Thanks to all of you who've been viewing the live stream and sending in questions and comments. The workshop video will be posted on this webpage in 7 to 10 days, and all registered attendees will be sent a link to give feedback, and the link will also be posted on this page. Thank you so much for joining us for the past 2 days. Have a good evening.